Orthopedic health information brought to you by Professional Orthopedic Associates.
Common questions that we receive are, what about return to sport? Different surgeons feel different ways, and I think that this is individualized to each patient. But the vast majority of our patients are returning to some type of sports activities within 4 to 6 months of these types of surgeries. That's oftentimes dependent on how hard they work in rehab and how their motion and their strength comes along. Our criteria for returning to patients to sport are typically to have a full knee range of motion, to have 85% of the strength of their contralateral extremity, and oftentimes for the first year after the surgery, we'll put people into a knee brace to help protect the ligament from re-injury. On that note, it should be stated that when we use tendon grafts to reconstruct the ligament, those grafts are seen by your body as being a piece of dead tissue. Initially, those are very strong when we put them in, but they do weaken over the first 3 or 4 months after the surgery. Fortunately, your body uses that as a scaffold to build new tissue into, such that there's a turnover process that takes time. Most of us feel that that time frame is somewhere in the order of about a year to a year and a half after the surgery. So certainly in that time frame, there is an increased risk of re-injury when patients do return to sport, such that the use of a brace is oftentimes helpful to help prevent the recurrent injury. We believe that about 7% of people, despite having an adequate reconstruction of their ACL, are at risk to re-injure that ACL at some point in the future. The highest percentage of that small group is going to be in that first year where that graft is somewhat at risk.
This has been Orthopedic Health Information brought to you by Professional Orthopedic Associates.